the field and from practitioners on having more practical tools for cash and child protection programming. And I remember we used to have all of these conversations about that we have a lot of work that has been done for policy or research, but we definitely had a gap when it comes to practical tools. So I really think that this tool, the monitoring and evaluating child protection using cash and voucher assistance, is much needed for both child protection and cash teams. So without further ado, I'll hand it over to Lori and Hannah to walk us through the tool. Thank you.
Thank you so much, Maret. And I should just flag to everyone that we are recording today, just to make sure that others who aren't able to join can catch up with us. So we're really, really excited. As Maret says, this has been an ongoing process for quite some time. So we're really thrilled to actually launch these tools today. What we'll go through today is just a really brief background on the toolkit, look at the various components of the toolkits and look at the tools. We'll have a really quick introduction and kind of spotlight on Peru and how they contextualize the tools. We've allowed some time for discussion, so it can be a bit more interactive, and we can discuss kind of the challenges and mitigations and how we actually use these tools. And then we'll look at what's coming next in terms of tools and resources based on this, and then finish with a Q&A. One note I should make about the Q&A is that we might be a bit short on time today, but please do feel free to write your questions in the chat box. Hannah, who's the lead consultant on these tools, has agreed to monitor the chat box so she can respond. And there we go, thanks, Hannah. And also at the end, if we reach a critical mass, we can always have a Q&A document that we circulate around. So before moving ahead today, we wanted to know a bit more about actually who's on the call, who was interested in joining this. So if I have managed this successfully, I'm going to launch a Zoom poll, which should pop up onto your screen now. And the poll question is, what work have you done before on child protection and cash and voucher assistance? Great, I see responses coming in. So the options are, I've never worked on cash and voucher assistance before. I've never worked on child protection before. I'm just looking to integrate cash and voucher assistance interventions into my child protection programming. I've been running cash and voucher assistance as part of child protection programming for a while. I'm supporting other sectors to consider the impact of cash and voucher assistance interventions on children or on child protection outcomes. And I work on cash and voucher assistance in another sector or multi-purpose cash and want to start thinking about issues relating to child protection and safeguarding. I'll give that just a few more seconds while people get their votes in. Okay, great. It looks like we've got a good turnout. And I hope you can all see the poll results. So it looks like the majority of those on the call work on cash and voucher assistance in another sector or multi-purpose cash, but want to actually start thinking about how do we think about child protection issues or safeguarding issues, and how do we start to incorporate them. And then great to see that we've got some just looking into integrating cash and voucher assistance interventions into child protection programming, and some looking at supporting other sectors. So this is fantastic. These tools in this webinar is really kind of for across all of those different areas. So you're very welcome to be here if you've not worked on cash before, if you've not worked on child protection before, or if you act in a role where you want to start supporting or further strengthening the integration between cash and child protection. Thanks so much. So we wanted to start with just a little bit of a background around the toolkit. This has been an interagency effort under the Alliance for several years. So an interagency steering committee commissioned a scoping study conducted by Paul Harvey in 2019. And that is the picture on the right there, is the final product of that study. And this was to try understand more about what is needed in regards to monitoring child protection within cash and voucher assistance. So the report ended up making the recommendation, or rather the findings were that there is a gap in guidance. We don't want to duplicate what already exists, and we don't want to overburden cash actors with yet another series of questions or tools or whatever it may be, but rather have some way that we can also integrate them. So amongst several recommendations, one recommendation was specifically for a toolkit that can be used by child protection, cash, other sectors, and meal actors. The toolkit's aims, according to his recommendations, was to identify child protection risks in the programming, identify mitigation strategies, and monitor child protection outcomes. I think, as a lot of us on the call know, the evidence is spotty, or rather we are lacking kind of robust evidence when it comes to certain child protection outcomes and cash assistance. So the idea of this toolkit would be then to have the tools to measure and actually start building towards that evidence. So the process then was led by Hannah Thompson, and it consisted of a literature review and a drafting process. As mentioned before, there was this interagency reference group that reviewed and provided revisions. We also got interagency feedback from colleagues in Nigeria, Somalia, Cambodia, Colombia, and Venezuela, and I might be missing a few of those. The tools were then pilot tested, originally with the idea that Hannah could go and actually pilot test them in a country and support a few other countries remotely. But this was planned for last year, and of course, because of COVID, some of those plans got thwarted. So some of the tools were pilot tested in Syria, and others we received just feedback on. And the tools were then finalized this year and are currently in the process of being translated and disseminated. So right now, I'll share the link on the next slide. We have the tools uploaded in English, and shortly we'll be uploading the French, Arabic, and Spanish versions as well. And with that, I'll hand over to Julia.
Thank you so much, Laurie. Hi, everyone. My name is Julia. I am a cash advisor working with Save the Children and have been heavily involved in the piloting phase of this project. So we're going to look a little bit more into details at the components of this toolkit. So you can see on the slide the three different tools that have been developed. They're all part of the same toolkit. And as you can see on the next slide, sorry. Thank you, Laurie. As you can see on the next slide, so the logic of the toolkit is mostly divided into, let's say, two main steps: before the cash transfer starts and after the cash transfer started. So we're now going to look at tool one, which is what we call the focus group discussion tool. Some of the cash colleagues like to call it more baseline. So essentially, this tool is structured as a focus group discussion tool, but can also be used as a key informant interview using a story. So the idea is to basically capture what are the main child protection risks prior to the cash transfer program. So this tool has been designed to be used by either child protection, cash actors, monitoring actors, or actors from other sectors, and to be administered with adults or caregivers within a community that have a very good understanding of what are the protection risks of children in that given community. So as I mentioned, it has been designed to be used before a cash transfer has started, ideally a month before, so that it can first identify potential child protection risk, and therefore also help identifying some potential actions to mitigate those risks, and to ensure that those are captured in time to potentially adapt the design of the cash transfers so that it really reflects those mitigation measures. To give you some concrete examples, when we run this tool into some countries, we have identified that the delivery mechanism that we had selected, which was like similar to a Western Union system where you go and redeem your cash, was being perceived by single-headed households as highly risky, because those households had to leave their children behind to go and pick up the money, or had to bring their children with them to areas that they were not considering as safe. So having this information prior to the cash transfer enabled us to make the required adjustments to ensure that those risks were mitigated. And I will pass it over to Laurie to talk about the second tool.
Thanks so much. So the second tool is a survey tool to be used by all sectors. So this is not specifically for child protection, but can also be used by child protection. And this is to be used after cash and voucher assistance has already started to be delivered. The idea of this tool is that it provides real-time information on child protection risks and benefits. And then this information can be used to inform adjustments to the way the cash and voucher assistance is being delivered. The first time that this should be run should take place between about 7 and 30 days after the CVA has started. Carrying out the survey will then help to ensure that respondents have a clear recall of the cash and voucher assistance and any safety risks related to it, identify any issues that are already arising, respond to incidents as soon as possible, and adapt the cash and voucher assistance as needed in real time to ensure ongoing safety. And I think one thing that's important to flag is that all of these tools are designed to actually be used for adults. And we'll see in the next steps that we've been working alongside Plan International to develop a toolkit specifically for adolescents. And we'll discuss that more later. So like the other tool, this tool helps to identify risks to children and helps to look at strategies for mitigating these risks and then monitoring the effectiveness of this risk mitigation, which is why we recommend it happen several times throughout the cash process. And I'll hand over to Julia for tool 3.
Thanks, Laurie. So tool 3 is more adapted to programs that have an active case management component integrated into the CVA. So the logic is that we can collect similar information to tool 2, but through case managers. So it's also under the form of a survey, or it can be run as a key informant interview. Similarly, those can be uploaded to Kobo or use on paper survey. It has been designed to be used by caseworkers or child protection staff, with the idea of interviewing or surveying adult caregivers who are receiving case management support as part of the child protection program. So as for tool 2, the idea of this tool is to collect information after the cash transfer started. So it should be used as a post-distribution tool at different frequency, depending on the length of your program and depending also on the meal capacity. Next slide, please, Laurie. So here again, it will help you to determine if the cash transfer or the voucher assistant has contributed to child protection outcomes. It can inform you on adaptations of CVA to improve the outcomes for children. It can help you identify any risks that CVA poses to children that might not have been identified during the baseline or during the use of tool 1. It can also help you identify strategies for mitigating those risks and to make the decision at the right time on mitigating risks as they arise. It can also help to monitor the effectiveness of risk mitigation mechanisms if you have set up some of them at the design stage in response to tool 1. So in the next slide, we're just going to recap the timeline for using these 3 different tools. So ideally, whenever possible, 2 to 3 months before you start cash and voucher assistance, you would start looking at this toolkit with your teams, select which one you're going to be using, which one is the most appropriate, adapt it to the context, potentially translate it into the local language, and start training your team or start piloting test tools for suitability. Then ideally a month before you start cash and voucher assistance, you would use the first tool, so tool 1, that, as we discussed, acted a little bit as a baseline, but also an assessment, a risk assessment that enables you to identify what needs to be done to ensure that the cash transfer is child sensitive, and also to identify potential risks that you would want to mitigate throughout the implementation of the cash program. Then the cash and voucher assistance starts, and then after this, that's when you would start using either tool 2 or tool 3, depending on which one is most adequate to the program that you're implementing. And then you would continue using those tools based on the monitoring plan that you have pre-agreed. And once the cash and voucher assistance ends, then you can carry out the analysis of data. So now I just wanted to give you a quick spotlight on one of the countries where we have been using these toolkits. So in Peru, Save the Children is responding to the Venezuela crisis and providing integrated cash assistance, so integrated with child protection and nutrition components. So this program has been running for quite a few years now. So the piloting of this toolkit happened while the program was already being implemented. So the team chose to start with to only use the second tool, so the PDM tool. And since they're not using case management, they decided to use the tool 2. What they've done in terms of process is looking at the toolkit and take the questions that they thought were the most adapted to the context and integrated them within their regular post-distribution monitoring tool. So this means that the information from the toolkit is being collected every time that the post-distribution monitoring is happening, so on a monthly basis in this case. The reason why the team chose to do that was that they felt this would be easier and require less field work or data collection work to just process it within the regular monitoring system. So this integration has recently happened. It has happened in January. So for now, we only had 2 months of data collected, but we already saw that within those 2 months, there was a reduction in 5% of child labor. Sorry, within 1 month, we saw a reduction of 5% in child labor in households that were receiving cash, and that reduction was specifically linked to cash transfer by beneficiaries. We also compared this. This is a data that we were collecting at selection stage, and we also saw a reduction in 11% in child labor, thanks to the cash transfer compared to prior to the cash transfer. Beneficiaries also reported through the PDMs, well, now the adapted PDMs, an improvement in child safety thanks to the CVA, 10% increase within a month, and 97% reported that the CVA had a positive impact on family dynamics at home. One thing that the team highlighted was also that the use of this toolkit enabled them to receive some programmatic recommendations to make CVA processes more child friendly. So some recommendation, for example, on how they were distributing cash, on delivery mechanisms that could be more appropriate, as well as feedbacks on how to identify most at-risk groups.
Great, thanks so much, Julia. So what we wanted to do now is just allow some time for us to actually have a discussion about kind of cash and voucher assistance and child protection programming. What we're going to do is break out into 4 breakout rooms, and you'll have a facilitator in each breakout room, and just bear with me because I might have to just do some tech around it. In your breakout room, you'll be assigned to one of 2 groups. The group will either be asking what are the challenges associated with cash and voucher assistance and child protection programming. This can either be based on your experience or based on kind of what you anticipate and what kind of mitigation measures could we put in place. And the second group, the group 3 and 4, sorry, will look at who would the key stakeholders be in the contextualization process. We're going to use Mural, and I've put a link in the chat box. If I could ask you to all click on that link now, and I will share my screen just so we can see what it looks like. Give me a moment. Okay, great. Can you see my mural now as a shared screen?
Yes, we can.
Yes.
Thanks so much. So in here, you should be able to click. I see people slowly joining, which is fantastic. You should be able to click on this square here that shows up as text. You can click on a sticky note, and that should show up in the screen. Either to, if you're in the group looking at challenges, and then you can include here the challenge that you want to list. And we should all be able to access this and edit it at the same time. If you have trouble accessing this link or editing on it, don't worry, we're going to be in smaller breakout rooms so you can also discuss or include it in the chat box. And I know this was a fairly quick demo, but just to show it one more time, if we just click on this square here, and then if you click on a sticky note, feel free to use any color, you should be able to have it just pop up on the screen, and then you can write in that. So I will now break us into breakout rooms, and you might just have to give me one moment to move some people around, just make sure we've got a facilitator in each room, but it should be opening up on your screens now.
because I'm not quite sure what our question is and whether we do it all on the same Miro board. So I'm really sorry I didn't.
Hi, sorry, I've joined late, just getting people into the right room. Thanks, Yolande. So I hope everyone can click on the mural link. I'll copy paste it in here again. And I will share my screen. So our question in this breakout room is question 3 and 4. Who do we think would be the key stakeholders to engage in the adaptation or contextualization process? And if you aren't able to access Mural, please don't worry, just feel free to take yourself off mute or add in the chat box. I don't know if anyone has. Great, yes, I see already one person going in there saying government and social protection actors, absolutely. I think that's a big question that's come up a few times is trying to understand if are these tools effective for social protection and can they be used, which we think they can. They would just require maybe a bit of adaptation. But we want to definitely make sure we're making that linkage with social protection actors. Great, thanks, Andrew. Religious leaders, absolutely. We might want to engage religious leaders, especially to try identify maybe the child protection risks. Great, thank you. I can add that in there. Great. Is there anyone else we would want to engage? Great. Children and adolescents themselves, absolutely. We want to see that they have a kind of their say in this and what's the most effective way and understanding the risks. And like I said, we've got a toolkit that we're working on now with Plan International, where we're looking at how we further engage adolescents, because of course there's different considerations. I mean, I think when it comes to the fact that we have so many sectors working together, or, you know, we're talking, in order for this to be successful, we really need the buy-in of Neil, of cash teams, and of child protection teams. And that might all sit within the same organization, or it might well be an interagency effort, or even working with the government. So I think also thinking about kind of those different stakeholders that we would want to engage. Oh, great. I see local meal and CP staff. People who are dubious about cash transfers versus in kind. Absolutely. We see that people are worried about the potential risks related to cash and provision of cash. Great. Thanks, Andrew. Non-cash actors. Absolutely. Parents and guardians. Yeah, fantastic. Thanks for that. If we are using, I mean, I think for any cash programming, but for cash and child protection, one of the big questions child protection actors have had is how do we sensitize the community as well on this type of programming? You know, because if it's cash for child protection, how do we do that in a way that's sensitive, that doesn't potentially expose people for being part of a case management program, but doesn't also put people at risk? So Great. Yeah, religious institutions, I see churches as well. Gender inclusion specialist, that's a really fantastic one. We had a gender specialist review the tools as well, but definitely in terms of that contextualization process, that would be really relevant. And disability, absolutely. Okay, I see camp authorities, absolutely. DPOs, fantastic, yeah. And clusters, yes, absolutely. We need to make sure that what we're actually, the design of the program is in line kind of with what's being done at the interagency level. And then that if the more we can systematically roll these tools out. So a lot of the feedback we got was either from kind of working groups or AORs working together to provide feedback, or consortiums that were working on this, which was really helpful because it has to be an interagency effort. Great. Donors Fund as World Bank, fantastic. Is there anyone else we would maybe want to engage even throughout, as we identify potential risks, is there anyone we would want to engage as we look at mitigation strategies?
May you come again?
Yeah, absolutely. So my question was, we're looking at stakeholders now engaging in the adaptation and contextualization process. Are there any other stakeholders you would want to engage if we're using the tools and we start to identify risks that you would want to engage at that point to look at mitigation measures? I hope that was a bit clearer.
Yeah, I found something in to respond to that, Lauren, about social services and complementary services. So if there's particularly at-risk families already experiencing violence or very, gender-based violence, whatever, in their home, they might need referral, right, to protection services.
Absolutely.
Yeah.
Yeah, absolutely. And making sure that we've got that in place before we're starting, so that we could have a strong referral mechanism in place. And I think that referral has to go both ways, between actors who are implementing cash, being able to really know the referral pathways and how to identify a concern, and then the other way around, where it might be a child protection actor who can then refer for cash and voucher assistance. Great. And other CP actors that are not doing cash, absolutely. We want to make sure that that referral system is linked and based on need. So it might be a child protection actor that's focused on case management, but would really benefit from knowing how to do that referral, or a family they're working with is receiving cash and then they could be using the tools.
Yeah, I was just thinking about even other sectors where you have a case that basically the service they need is like nutrition service or health service, and if they are not part of the conversation, the mitigation, it may not be it may bring some loopholes. So including all those sectors, health, nutrition, it could be shelter, to kind of help on how to resolve all these challenges that are coming through.
Yes, thank you so much. I think that's a really great point. We designed these tools so that it wouldn't be just strictly for child protection, but even if you've designed a program that is cash for health, for shelter, as you're mentioning, for nutrition, that you can use these tools to measure, even if your intention was never to actually look at child protection outcomes, it can still be used within that program.
I'm trying to think laterally, but I'm just going to throw something out there to this crowd. As a cash kind of advocate, really, myself, I often hear people worrying about the negative impacts of cash on households. And I do think that there are risks to be mitigated, absolutely. But I often wonder whether we examine cash more thoroughly than we do in almost any other policy response. Do you know what I mean? It's been very controversial, I guess, and it has been very studied. So that's why I put in the thing about people who are dubious about cash versus in kind, or, you know, I think it would be really interesting to understand if cash does have a more, should we be looking at like cash versus in kind versus other types of assistance and the risks and mitigations around child protection for all of them? Because I just think it has got a particularly, I don't know, people seem to be very worried about it with cash. And I'm just curious to, like, what is the evidence base that it is more risky than other types of intervention? Does anyone know?
Maybe just to add a thought from my side, I think it has to do also with like other services, issues of security and sustainability as well, and making sure that cash is integrated and taking into consideration all of the other aspects of the community or the ecology where it's being distributed, and not just something that is done as a project with a certain timeline without really considering what's next. And also how, like, I feel with other services, you do have certain change that you want to bring to the community. So you work on certain programs that target more of behavioral changes or target more of systematic changes. So I feel this is why I'm more geared towards cash plus programs more than maybe cash as a standalone, but this is just a thought out there.
Thank you, that's really helpful. I wouldn't apply so much to social protection then, but I think, yeah, I think interesting to think that maybe people think it's easier to drop cash in and don't think about the ecosystem it goes into, as it were. Thank you.
Exactly.
I think another question we've been asking is, I think there's this aversion, and we've got 7 seconds left, but to distributing cash to unaccompanied children, but what's the risk with not doing it? Which has been a question.
That was a great last comment, whoever in our breakout group. Someone just dropped a really good comment. I think it was Lauren. As we got booted back.
Yes, I tried to get that in 7 seconds, which was the fastest I could do. Great. All right, thanks so much, everyone. I think that was a really rich conversation. I'm going to ask if the facilitators for each room wouldn't mind just highlighting a few of the points of discussion you had, or some of the highlights from your room. And I see that it's still getting generated. So Alison, can I start with asking you, and also asking you if you can see the Miro board on my shared screen still?
I can see it, yes. Hi, everyone. My name is Allison. I'm a humanitarian child protection specialist at SCUS, and I'm going to be sharing for group 1. So many challenges that we talked about were related to unintended child protection negative outcomes, such as encouraging family separation, child labor, potentially child marriage. So we were talking about how we can mitigate those. People were excited about tool 1 of the toolkit to be able to understand what those risks might be at the design stage and not at a sort of response stage later on. Also discussing eligibility criteria with community members to avoid perverse incentives. We also talked about the way cash is distributed, potentially entrenching damaging gender norms or power dynamics, and talking about embedding a power and gender analysis in the design and intervention in order to mitigate that. Also some ideas about mitigation, techniques or activities could be to have childcare facilities, for example, to allow for adults to participate in cash for work programming without either leaving their children at home or having their children work in labor. So we had a pretty rich discussion about sort of who controls spending and all of these other risks. So I won't get into all of them now, but I think we came up with quite a few.
Great, thanks so much, Alison, in Group 1. That is really great, and a lot of what we've been seeing come up even through the piloting, so that's fantastic. Hannah, were you Group 2, or was it Julia? I think it might have been Julia, actually.
I was Group 4.
You were Group 4. Okay, Julia, do you want to comment on anything else around the challenges and mitigation measures?
Thanks, Laurie. So we listed a very long variety actually of potential risks and challenges, some of which have already been mentioned. We talked about questions around data protection, obviously transfers of cash to children and associated risks of exploitation. We talked also about some operational challenges that were more associated to cash. We talked about risks of community tensions, and on that point, I gave the example from one of our pilot countries where the use of the tool 1 enabled us to identify in advance that the design that we were planning was subject to create quite a lot of community tensions, and how we have used the information collected in there to rectify that. I don't know if I missed a little bit of the beginning. I don't know if Nick wants to add anything, or anyone from my group.
No, I think that covers it.
Great, thanks so much. And Hannah, do you want to talk a bit about your group in the discussion?
Sure, yeah. I'm afraid we didn't use Mural, or I certainly wasn't adding to Mural as we went along, but I can add to it now. I've written notes. So we were talking about the different stakeholders we want to engage in the contextualization process. And we included and discussed your cash officers and cash advisors in your local context, your child protection advisors. You'd be wanting to talk to education cluster and other, depending on the objectives of your program, other clusters that are, seeking to meet those same objectives. Your local partners, someone raised the issue that there's your internal and your external, so you'd want to be talking to child protection or CVA actors within your organization, but also actors, staff, but also outside of your organization, so linking up across different clusters and working groups. Someone mentioned protection and the rule of law, and your M&E colleagues and cash working groups or consortiums. Yeah, I think that's it, unless anyone wants to add anything.
Great, thanks so much. And I think just to complement from our group, we talked, I think, about a lot of the same, but also looked at having a gender and inclusion specialists informing this process, and DPOs, disabled persons organizations, to make sure that we're kind of capturing those risks correctly, we're adapting the tools appropriately for that context. There was some discussion around camp authorities. We also discussed the different sectors in the cluster, and then there was also a discussion around engaging children and kind of families themselves. And we had an interesting conversation kind of nearing the end of our time, which was around what are the risks around cash, because we do see people are dubious towards cash transfers as opposed to in kind. And so what are these risks, and some of the discussion we had around that was issues around sustainability, or that it's just kind of dropped in and then left rather than a cash plus program. And then, yeah, also understanding what's the risk of not distributing cash if we're to withhold, which I think has been a conversation we've had. So thanks, everyone. I'm impressed it worked, because I know sometimes Mural can be quite tricky. I'm going to just stop sharing this if there's any thoughts to add, and then just share the PowerPoint, please, Hannah.
Yeah, just one thought I had, because I was working on a section on accountability and PSEA in the CVA for unaccompanied children and childhood households today. And I was thinking that I think that's quite a key contact to identify what safeguarding risks might be coming up and being identified across sectors. And then if they've heard of anything specific to CVA in your setting, and that might inform how you adapt your tools so you can pick up on those kinds of risks that are, you know, looking more likely in the location.
Great, thanks so much. So in rolling out these tools, or in piloting these tools and developing these tools, we found, and I think this often happens, kind of the more you create, the more you realize you're missing. And so we have secured funding from CEDA this year to work on a few additional tools, which I just wanted to put up here because I think it might hopefully answer some questions that are coming up. So one is and I'll just kind of run through these fairly quickly, but we'll also share the PowerPoint, of course, in the recording. But one is actually a toolkit for caseworkers themselves. So if a caseworker is working with a family, a child protection caseworker or social worker, who's receiving cash assistance, then this is a toolkit to support that caseworker in their case management process, looking at kind of budgeting and how to plan for expenditure. As I said before, we're working on the translation into Arabic, French, and Spanish, so they will be uploaded onto the same site on the Alliance, so just please keep an eye out for that. Questions came up about, okay, great if we can identify risks, but then how do we actually mitigate for those, and how do we actually analyze the data from this? So there's a guidance document that will be uploaded really shortly, again in that same spot on how to actually analyze the data. And this has been done in coordination with the Assessment, Monitoring and Evaluation Working Group. We've been working with Plan International and the Women's Refugee Commission to actually expand this toolkit beyond for adolescents. And that was a question that came up really early in our piloting, is great that we have tools for adults, but what about adolescents? And so that is currently in draft that being worked on. And then we're also going to be working alongside Plan International to have a capacity building package, and that's geared towards monitoring and evaluation, child protection, and cash actors, to start to learn, maybe even demystify the sectors for each other and start to learn a bit more. And then guidance on cash for child-headed households and unaccompanied children. So this is currently in process, and I think that a big question, at least I know, and Save the Children we get is, should we be distributing to unaccompanied children? Under what circumstances? How do we mitigate for risks, etc.? And then lastly, as this toolkit gets used, we would really welcome to hear from you if you're using the toolkit, data that you're gathering from that, so we can keep generating and building this evidence base that's so critically needed for child protection and cash. And then finally, we'll have this kind of very similar to the capacity building package, but actually in a programmatic guidance on the integration of cash and child protection. And so that's really it in terms of presentation. We've got, I think, about 5 minutes. I don't know, Hannah, if there's any questions that have come in through the chat box. No, okay.
No, I haven't seen any questions come in.
Great. Are there any questions? We probably have time to take about 2 or 3 if we have some.
So sorry, I do see that. Could you please share the PDM format, or is it the tools too, as I see the link in the shared folder is coming from Jose. So at the moment on the website are 3 full tools, so tool 1, 2, and tool 3. There's an overview document that just explains which order you use them in, and then there's quick guide versions. And then we do have the Kobo Excel files that are adaptable for Kobo, that we will upload soon. Is that what you're meaning by a PDM format? Because basically you can choose questions from tool 2 for inserting into a PDM. Is that what you're meaning, Jose?
Also, just to complement on what Hannah just said, so since I see Jose is from World Vision Colombia, Save the Children Colombia has been piloting these tools, so they have all the toolkit translated and already uploaded into Kobo, so you can check directly with them for that.
Great. Thanks everyone for the kind words and those who've also contributed to these tools. They've been over a year in the making, so really exciting to have them.
If we've got a little bit of funding, are we going to be able to do a little bit of a follow-up in a few months on like people's experience of trying them?
So,
go ahead, Hannah.
So the intention is, so we're getting data in now. So we're hoping to pilot test in a number of countries last year, but obviously with COVID, that wasn't possible. We only were able to do that in Syria with a limited number of people. So we have been rolling out the tools in various locations, including Guatemala, Peru, Colombia, Syria. Julia, please add if I'm missing some.
Cambodia as well, and
Cambodia,
soon
yeah.
Venezuela.
And so we're hoping to, well, we plan to produce a report that will summarize and synthesize the kind of findings that we're getting. So as you saw in the presentation earlier, there were some findings already from Peru, but we're going to hopefully draw all of that together so we can have a better understanding of what the risks really are related to CVA and what mitigation strategies are working and what potential child protection outcomes that are positive we can see from the use of CVA, even when it's not intentional. So yeah,
yes, Hannah, don't forget also South Sudan.
South Sudan, have you been piloting using the tools? I didn't know that.
It's not there on the list. Please, next time we want it to be there.
Sure.
Okay, thank you.
Oh, that's great. Thank you. And I think this will be really interesting in this year on the International Year about ending child labour as well. You know, if we can pull some interesting, like, anyway, just be really interesting to see the effects on child labour, for example. So anyway, really congratulations and thank you very much for all you do.
Okay, bye-bye.
Great. I think if we don't have any more questions or anything else, thank you so much for joining and thanks for being part for all the countries who piloted, including South Sudan. We're sorry we didn't mention that. And we will circulate around the presentation, but please do feel free to go check out the tools, and Hannah's put in her contact for questions. Yeah, Hannah, do you want to give us a closing word?
There is one last question from Cameron about the data analysis tool. We have that in draft form and we are going to put it up as a Word document that isn't design. I just need to integrate a couple more comments and then it will go on the website, but people really kind of need it quite soon. So it was going to go online in a polished but not final version, I think, for the moment. As we continue to test and use the tools, we might continue to adapt them. So hopefully, yeah, very soon in the next couple of weeks. But that's the same as Laurie was saying earlier with the translations, the Kobo tools, etc. If people just keep going back to the website and checking, we'll be uploading things as they're finalized, and there are more tools coming forward in the future. But yeah, thank you everybody for taking part. It was really interesting. And my email, I can type my email address again for anyone who can't see it, but if you scroll up, my email address is there, so if anyone has any questions, please do feel free to get in touch.
Great, thanks everyone, and have a good rest of your day. We'll share the recording as soon as we can.
Thanks everyone.
Take care everybody.